One study has found a lack of physical activity is associated with poor periodontal health and an increased risk of periodontal disease, while another large study found higher levels of physical activity appear to protect against the periodontal disease. Preclinical and clinical research has shown exercise reduces gingival oxidative stress and inflammation, and this might contribute to the improvements in the periodontal health observed in older adults who engage in the physical activity. Antibiotics and antimicrobials have long been a mainstay of periodontal disease treatment. However, there's growing recognition that periodontal disease is caused in large by dysbiosis and the emergence of increasing numbers of antibiotic-resistant bacteria strains that limit the value of the antibiotic treatment for the periodontal disease. This has led researchers to investigate the potential of probiotics for restoring the health of the oral flora. Probiotics are microorganisms that, when delivered as a supplement, they displace the harmful bacteria and they deliver health benefits. Probiotic bacteria that can establish the long-term colonies in the oral biofilm might be helpful for preventing and treating periodontal disease. One of the most promising of these bacteria is Streptococcus salvarius. In a clinical study, adults with moderate and severe gingivitis and moderate periodontitis were treated with either probiotic lozenges providing the Streptococcus salvarius strain M18 bacteria, or no lozenges for 30 days. They were examined twice during the treatment period, and 15 and 30 days after the end of the treatment. The subjects in the probiotic group were found to have less plaque, better gingival health, and less bleeding on probing than the no probiotic group. Their plaque index score decreased by 44% by day 30. Their gingival index score decreased 42% by day 30. The sulcular bleeding index score decreased 53% by day 30, and the probing pocket depth decreased by 20% by day 30. Intriguingly, subjects who received the S. salvarius probiotic exhibited superior scores on these indices even 30 days after they stopped using the lozenge. This study demonstrated the ability of the probiotic lozenge to significantly improve all four of the commonly used assessments of periodontal health. In children, a randomized control trial showed supplementing with the S. salvarius strain reduced the plaque buildup, and in addition, the salivary bacteria cultures showed the children with the greater number of the S. salvarius after the treatment also had reduced numbers of cavity-associated S. mutans, and this suggests supplementing with this probiotic can prevent cavities. It's also been shown to improve bad breath or halitosis. S. salvarius promotes oral health via several mechanisms. First, it produces enzymes that break down plaque. Next, the probiotic helps to maintain the healthy oral cavity pH, and this is important because an imbalanced pH in the mouth can lead to tooth demineralization. And finally, the S. salvarius produces powerful antimicrobial compounds called bacteriocin-like inhibitory substances, or lantibiotics, and these lantibiotics destroy disease-causing bacteria in the mouth. An article published in Science Advances provides intriguing evidence that Alzheimer's disease could be caused in part by an infection of P. gingivalis, a keystone pathogen of chronic periodontitis, which is a significant risk factor for developing amyloid beta plaque, dementia, and Alzheimer's disease. The scientists studied and they compared brain tissue samples from Alzheimer's disease patients and neurologically normal controls. Interestingly, they found a portion of the healthy brains were infected as well, indicating that a brain infection with P. gingivalis is not a result of poor dental care. Following the onset of dementia, or a consequence of late-stage disease, but it's an early event that can explain the pathology that's found in middle-aged individuals before cognitive decline. These findings suggest better dental care earlier in life might promote brain health later in life. Xylitol is a small carbohydrate and it's sometimes used in the food industry as a sugarless sweetener. It's been widely studied over the past 4 decades for its anti-plaque and anti-cavity effects, and it's been found to decrease salivary acidity, reduce levels of plaque, harmful bacteria and gingival inflammation, prevent dry mouth and enamel erosion, and improve salivary flow. One trial showed xylitol consumption reduced levels of cavity-causing S. mutans bacteria immediately after use, and this effect continued after the subjects stopped using the xylitol. Supported by a growing body of evidence demonstrating its beneficial effects, xylitol is now available in therapeutic anti-cavity toothpaste, candies, chewing gums, syrups, and mouthwashes. Evidence for a deficiency of CoQ10 in gum tissue of patients with periodontal disease and for a beneficial effect of CoQ10 supplementation has existed for decades. The mechanism behind the relationship lies in CoQ10's important role in controlling inflammation and in regulating oxidative stress. A randomized control trial of 120 mg of CoQ10 in 30 patients who underwent root planning and scaling found a significant reduction in inflammation of the gums in the CoQ10 group after 1 and 3 months compared with the placebo. In preclinical and clinical studies using topical oral applications of the CoQ10 to the diseased periodontal tissue, the CoQ10 therapy improved the periodontal health and inflammation, including as an adjunct to the scaling and the root planning. An animal study showed the CoQ10 moderated the negative effects of omega-6 fatty acids on the periodontal-related bone loss. Fish oil and its omega-3 fatty acids EPA and DHA have shown benefit in a variety of inflammation-related conditions, including cardiovascular disease, diabetes, and autoimmune disease. Interestingly, periodontal disease is bidirectionally associated with these conditions. Findings from several studies suggest that people with periodontal disease have a lower intake of anti-inflammatory omega-3 fats and a relatively greater intake of pro-inflammatory omega-6 fatty acids. In one study, 80 patients being treated for periodontitis with scaling and root planning were given either 900 mg EPA plus DHA and 81 mg aspirin daily or placebo. After 6 months, those receiving the omega-3 supplements and the aspirin had more improvement in the pocket depth and better gingival health. Lycopene is a red plant pigment and it's found in foods like tomatoes, watermelon, papaya, and pink grapefruit. It's in the family of plant compounds known as carotenoids, and like other carotenoids, it has well-established anti-inflammatory activity. A randomized control trial in 20 healthy participants with signs of gingivitis found 8 mg per day of lycopene taken orally was significantly more effective than a placebo as an adjunct to regular dental care in the treatment of gingivitis. Similarly, another clinical trial in 42 patients with chronic periodontitis already being treated with scaling and root planning found 8 mg of lycopene per day resulted in greater improvements in indices of periodontal health when compared with a placebo. In a randomized trial, patients with both periodontitis and diabetes were treated with scaling and root planning alone or in combination with 8 mg of lycopene per day. Those taking the lycopene had greater reductions in periodontal pocket depth, as well as improvements in blood glucose control. Vitamin E, particularly gamma-tocopherol, might favorably influence periodontal disease, while in animals alpha-tocopherol has improved gingival healing, prevented bone loss and decreased local inflammation. Lower blood vitamin E has been associated with more severe periodontal disease. One study found lower blood and saliva levels of superoxide dismutase, an important enzyme that quenches oxygen-free radicals, in 38 subjects with chronic periodontitis when compared to 22 people without periodontal disease. The periodontitis subjects were then treated with scaling and root planing alone or with the addition of 200 mg, which is 300 international units of vitamin E every other day. After 3 months, the vitamin E group had greater improvements in the periodontal health. In addition, their superoxide dismutase levels increased in those who were receiving the vitamin E. Curcumin is a polyphenolic phytonutrient from the culinary spice turmeric, and it's well known as an anti-inflammatory agent. It's also shown antimicrobial activity against bacteria that's implicated in gingivitis and periodontitis. Several studies have demonstrated curcumin applied directly to the gums demonstrates effectiveness comparable to conventional antimicrobials, and it's a useful adjunct to scaling and route planning for gingivitis and chronic periodontitis. In lab studies, curcumin also inhibited periodontal disease bacteria and biofilm. Rodent studies have shown supplemental curcumin can reduce periodontal disease-related inflammation in the mouth by inhibiting the expression of inflammatory cytokines and by reducing the activation of the inflammatory mediator nuclear factor kappa B. This results in noticeably lower signs of inflammation. These studies use the equivalent of 386 to 1,287 milligrams of curcumin per day for a 175-pound person. In a randomized control trial, a highly bioavailable form of curcumin was found to deliver up to 7 times more bioactive curcumin to the blood than the previous curcumin preparations. Lactoferrin is an iron-binding protein, and it has antimicrobial and immune-modulating properties. It's found in saliva and other bodily fluids. In the mouth, the lactoferrin has been shown to help to control the growth of colonies of plaque-related bacteria that contribute to both tooth decay and periodontal disease. It inhibits the formation of pathogenic biofilm, and it can help to reduce established biofilm. In a clinical study, treatment with liposomal lactoferrin tablets, providing 180 milligrams of lactoferrin daily in 5 adults with periodontal disease, improved periodontal pocket depth after just 4 weeks. In another clinical study, oral lactoferrin reduced the levels of disease-causing bacteria under the gums of chronic periodontitis patients, favorably influencing the biofilm. A preclinical study concluded oral administered lactoferrin might be a powerful treatment and preventative therapy for periodontal inflammation, while 2 other lab studies demonstrated that lactoferrin can inhibit the growth and the biofilm formation of periodontal disease-associated bacteria. Calcium and vitamin D deficiencies are associated with osteoporosis, periodontal bone loss, and tooth loss, and adequate intakes are necessary for dental and periodontal health. In addition to enhancing the calcium uptake and the metabolism, vitamin D has anti-inflammatory and immune-modulating properties, but critically important for the maintenance of the periodontal health. Vitamin D also helps to prevent other chronic inflammatory conditions, including cardiovascular disease and diabetes. Supplementation with calcium and vitamin D might be beneficial for people with periodontal disease. In a preliminary study, subjects who took at least 400 international units of vitamin D and 1,000 milligrams of calcium daily had less severe periodontal disease compared with subjects who didn't take these supplements. The same subjects were followed for 1 year, and those who took vitamin D and calcium supplements improved more rapidly, with the greatest differences seen after 6 months of treatment. Another study in patients who are being treated for chronic periodontitis found supplementation with 250 international units of vitamin D and 500 milligrams calcium per day for 3 months led to markedly better measures of periodontal disease compared with no supplemental calcium and vitamin D. A large study that incorporated findings from a food survey, blood tests, and dental exams concluded low calcium intake results in more severe periodontal disease. In another study, women with the highest calcium intake were 47% less likely to have periodontal disease than women with the lowest intake. Similarly, individuals with low vitamin D status have been found to be more likely to have periodontal disease, and higher vitamin D intake might protect against periodontal disease progression. B vitamins are necessary for cell growth and metabolism. A study in 30 subjects with periodontitis who were treated with flap surgery examined the effects of vitamin B complex. In the flap surgery, severely infected sections of the gums are removed, creating access to deeper tissues and the tooth root. After surgery, the participants received either a placebo or a supplement providing 50 milligrams of B1, B2, B3, B5, B6, and 50 micrograms of B12 and biotin, and 400 micrograms of folic acid per day for 30 days. These subjects were then followed for up to 180 days. Those treated with the vitamin B complex after the surgery had more improvements in their gingival attachment at the end of the study. Folate is critical for normal cell division and for tissue repair. It has a special role in maintaining periodontal health, and folate deficiency is linked to oral health problems, including infections and degeneration and destruction of the gingiva, periodontal ligament, and the alveolar bone. Individuals with periodontitis have been found to have lower folate levels compared with those without periodontal disease. And a mouthwash with 5 milligrams of folate per 5 milliliters has been shown to improve the periodontal health in people with periodontal disease. Smoking depletes folate, and this might explain the co-occurrence of smoking and periodontal disease. The association between smoking and folate depletion has led some researchers to recommend folate supplementation for smokers with periodontal disease. Magnesium is necessary for a wide range of cellular functions. Low magnesium intake has been linked to periodontitis. In one study, people with the highest magnesium intake had a 36% lower risk of tooth loss compared to people with the lowest intake. And several studies have observed lower levels of magnesium in the blood of individuals with periodontal disease. Smoking and diabetes might worsen the magnesium deficit that's seen in people with periodontitis. Individuals with periodontal disease, and particularly smokers, might fare better if they maintain higher blood magnesium levels. There's also ample evidence that magnesium deficiency is associated with cardiovascular disease, and it's commonly seen in people with other chronic inflammatory conditions, including metabolic syndrome and diabetes. Vitamin C plays a critical role in connective tissue repair process and the regulation of the immune response throughout the body, and this makes it an important factor in the health of the periodontum. In fact, swelling and bleeding of the gingiva is a hallmark of a vitamin C deficiency. Vitamin C might also help to maintain the alveolar bone and help control the balance of oral bacteria. In a randomized control trial, 120 participants were divided into 4 groups of 30. The first group had no periodontal disease, the second had chronic gingivitis, and the third had chronic periodontitis, and the fourth had chronic periodontitis and type 2 diabetes. The subjects with periodontal disease were treated with scaling and root planing. Half of them were randomized to receive 450 milligrams per day chewable vitamin C or placebo for 3 weeks. The vitamin C administration resulted in significantly greater reduction in the gingival bleeding compared to the placebo in the chronic gingivitis and the diabetes plus the chronic periodontitis group. Zinc reduces the dental plaque and it's effective against bad breath. It also has wound healing, immune supportive and antibacterial properties, and these can all contribute to periodontal health. In one study, zinc deficiency was associated with an increased number of cavities and poorer gingival health in children. Low zinc levels have also been noted in people with both diabetes and periodontitis. Green tea leaves are a rich source of polyphenols called catechins, and these are well known for their ability to reduce oxidative stress and inflammation. Epigallocatechin gallate, or EGCG, is the most abundant and most studied of green tea's catechins. The researchers have found that green tea catechins have antibacterial activity against cavity-causing bacteria such as S. mutans and bacteria that's implicated in periodontal disease like P. gingivalis. Green tea catechins can also promote the oral health by preventing plaque formation, by inhibiting enzymes involved in tissue breakdown, and by preventing alveolar bone loss. A survey in Japanese men found the green tea intake was associated with better oral health. For each cup of tea consumed per day, there was a measurable benefit observed in the form of decreased average pocket depth, improved gingival attachment, and reduced gingival bleeding. Drinking the green tea has been recommended as a strategy for maintaining the periodontal health in patients with periodontitis. Green tea catechin extracts have been used as an ingredient in mouthwash or applied directly to the tissue with periodontal disease. This method has demonstrated efficacy that's comparable to conventional antimicrobial mouthwash in reducing plaque, and it can enhance the effectiveness of scaling and root planing, and it can treat periodontitis. Pomegranates are high in a wide array of beneficial polyphenol phytonutrients, and they've been demonstrated to prevent cancer, cardiovascular disease, diabetes, and other conditions. Pomegranate polyphenols are potent defenders against oxidative stress and inflammation. A mouthwash that contained pomegranate extract added to scaling and root planing performed comparably to conventional antimicrobial chemicals, and other localized applications of pomegranate have shown benefit in the treatment of periodontal disease. Essential oils are aromatic plant extracts that are rich in compounds called monoterpenes. Mouthwashes and toothpaste with essential oils and monoterpenes from plants like peppermint and clove have long been in use, and scientists now recognize the antimicrobial effect of these compounds might explain much of their benefit for oral health. For example, Listerine mouthwash contains 3 monoterpenes: menthol, thymol, and eucalyptol, and numerous studies have shown the Listerine is associated with decreased levels of harmful oral bacteria, plaque, and gingival inflammation. A randomized control trial in chronic periodontitis patients found an essential oil mouthwash significantly reduced the populations of 2 types of pathogenic bacteria, and concluded that an essential oil rinse might be an effective adjunct to standard treatment for reducing the bacterial count in the gum pockets. A study involving a mouthwash made from the essential oil of the Ayurvedic herb tulsi or holy basil found positive periodontal effects. In another study, 49 participants with gingivitis were treated with a topical 2.5% tea tree oil gel, and this also showed great improvements. For more on herbs, supplements, and natural treatment plans, check out my website.